Sharp, pastor of Faith Christian Center Church, right here in Beaumont, Texas. And we're here on what's happening in our neighborhood. And today, my special guests are Miss Dena Gray and Miss Crystal Williams.
Hello.
Welcome, ladies.
Thank you for having us.
Hey, well, tell us
Great
a little
intro.
I know, right? About yourself.
So, my name is Dena Gray, and it's Hughes. There's a married name on there. And I'm actually from Houston, and I transplanted to Beaumont about 3 years ago to take over and run TAN Healthcare.
You know, once you get in, you can't get out.
Cannot get out. Cannot get out. Thankfully, my family's from here, so I have a little anchor.
That's it.
Crystal, what about you?
I'm Crystal. I'm a licensed vocational nurse. I'm actually a Lamar alumni. I got my Bachelor of Science in Health from there. I'm a mother, a wife, and of course, a part of TAN, and absolutely love it. We do mobile medicals out there, so I'm with the nurse practitioner Anita Drake, and we work together.
Okay,
yes.
So what is TAN?
So TAN has a long history, all right? So it has many parts, right? Once upon a time, it was actually, TAN came into the community focusing on HIV and AIDS.
Okay.
We were serving the community in Southeast Texas. And this was back in 1987 when there wasn't a lot of options, particularly for communities of color who have always been impacted by Hep C or HIV.
Right.
So we did 30 years in that game. And you know, I have to say, it has been a wonderful ride.
30
had 30 years,
Yes.
30 years in 2017, had an anniversary, but at the same time, we were celebrating what we were able to be a part of. We also were making a transition. And so in 2016, we became a federally qualified health center, which means all the services that we provided for the HIV positive or HIV population, we now are able to provide those exact same services to anybody, regardless of what issues they may be dealing with. So primary care, behavioral health, we can do all of that. We can do all of those services. And so we've grown, we've expanded, and we're just happy to be a part of having healthcare conversations with a larger population, not just one group.
Now you talked about population. So Crystal, who do you serve?
Insured and uninsured.
Everybody.
Yes,
And
absolutely.
so
We
put
want
everybody
everybody. Yes, sir.
You
Everybody
don't
to
feel
come.
good?
That's right.
Come on in.
Absolutely.
That's how that goes.
So it doesn't matter whether you have insurance or not. If you're insured, then we serve most private insurances as well as Medicare and Medicaid. You just bring in your insurance. It's like, you pay your regular copay. If you don't have insurance, it's on a sliding scale fee. And our sliding scale fee starts at $10, and that does include labs. And people don't know that.
Wow.
Yes, absolutely.
So if a person doesn't have a primary care physician,
Yes, sir.
they could come into TAN and get
Absolutely.
all of their services done?
Yes, sir. They
Absolutely.
Can. Yes.
Wow.
Yes.
Hey,
We
It's
love
amazing.
hold up, that is
You gotta
amazing.
take a
It
second.
Yeah, the
You do.
realization of that thing
You do.
just hit me.
You do.
That
You do.
It doesn't matter whether you have insurance or not.
Yes, that is
Yeah.
correct.
Oh.
And
Yes.
what's really beautiful about the system called a federally qualified health center or a community health center is that we believe in the concept of having a patient-centered medical home, which means you go to the root, and wherever you need to go from there and whatever those needs are, we try to facilitate that. So you can come and see a doctor or a nurse practitioner. But if you come in and say, I'm having trouble getting to the pharmacy or getting to the specialty care in Houston, we have transportation services. And so
Yes.
when you going? When's the ride?
That is amazing.
But in order
know,
for
right?
people to be able to really manage chronic disease or crisis health, you can't cut off all the things that are necessary to achieve good health outcomes.
Wow.
So-
So Crystal, now earlier you said the blood work.
Uh-huh.
They can get blood work and all that.
Absolutely. So that's like your routine labs. You think about it, you do your complete blood count, and I know that's a lot, but that like checks for anemia and things like that. You can do your complete metabolic panel that checks to see your liver functions, your kidney function. So all that's like routine when you come in. Absolutely. So those are routine labs, and then based on the assessment of the nurse practitioner or the physician, then they may do additional labs based on that patient's needs.
Wow. So who makes up the staff of 10?
So we have a 35-member staff. We actually have 2 locations, one here in Beaumont
Yeah.
and the other one is in Orange. And then Crystal and her team, they do mobile. So they go all the way up to Trout Creek in Newton.
Wow.
They go all the way over to Liberty and Raywood. And so they see, we go out and actually
Okay,
post
so
up.
with the mobile, is that a scheduled time to go out? So
That is
those
correct.
In the you know
Yes.
in that area.
They
That
know
is
we're
true,
coming.
yes.
But
Yes,
they
they do.
actually have a full team that will will
Wow.
call. We'll do outreach, and they love the outreach part because outreach looks like going to Jenny's or Mr. Smith's donut shop and hanging out in the morning.
yeah.
And that's what the outreach team, they will go out because when you're talking about your health care, you can't just run up on someone and say,
Yeah,
come
yeah.
on in.
Absolutely.
So these guys
Yeah.
go out and they engage and they find out what are the needs. Because if the need is just getting you to an appointment, we got you. If the need is, seeing
Yeah.
behavioral health or being able to talk to a counselor, we got that. And so you have to know the need first before you can bring in the
Well,
service.
especially with the behavior, with all of the hurricanes that have passed.
Exactly,
People
yes,
are having
yes.
issues with
Yes.
that. So,
Yeah.
So you provide that service for them.
Yes.
That's
Yes,
why
we
they
do.
were actually started was in response
Yes.
to
Yes.
Hurricane Harvey, and we literally just said, "What do we do?"
Yeah.
And we were fortunate and blessed to have disaster-related funding that came in to the community and said, "What? How can we help you?"
Yeah,
So
yeah.
we sent them out, and they said they need a clinic in Raywood. They need a space in Trout Creek.
Wow.
Yes.
And we're working with churches, which is the beautiful piece.
That's good.
Churches are actually opening the doors and saying, you can set up here. And the best story I have to tell you. We had the absolute fortune of bringing on a nurse practitioner named Anita Drake. Now, I'm not from here, so I didn't know Anita
Right,
Drake.
right.
And when we began to send her out into the rural areas up in Woodville or Ivanhoe or Trout Creek, everyone started calling back and they'd say, "Is this Miss Anita's clinic?" Okay, yes, I guess it is. Everyone knows
Yes,
Miss
Anita.
Anita.
That's right,
She
that's right,
turned
that's
out
good.
she had years of experience in the
Yes.
community, and so people who might have had closures of their own clinics in their areas, they now have another connecting resource, and that's one of the things I love about our name, Triangle Area Network. We are a network.
And since Orange had to close this hospital down, I mean that's a big service for the Orange
Exactly,
community.
Yes, sir.
exactly, especially with the
Exactly.
transportation.
Yes.
Wow.
Yes.
That's a big piece.
So okay, so if people in Orange are watching today and they say I need an appointment in Houston, they could call the TAN network and say, hey, I need a ride. to Houston.
Absolutely.
Absolutely. And just keep in mind, though, that we do try to make sure that they understand it would be a TAN patient. We would love to transport people all
Okay,
over.
that-
we
that-
would,
that-
yes.
that's good. That's
we
good.
would, but they would need to be a TAN patient.
Okay.
But yes, sir, we would transport to Houston, Galveston, wherever that patient needs to go based on that referral.
Now
yes, sir.
let's go back to the staff. You said you have 35
35. Yes, we have
doctors
medicals.
and
Doctors,
practitioners.
everybody. We have Dr. Shannon Schrader is our chief medical officer, and he is amazing. He's been with us over 15 years, serving in the role of CMO. We have an internal medicine physician named Dr. Mina Tanaka. Awesome. So for chronic disease management, hypertension, diabetes, things like that. Wonderful, wonderful resource.
That sounds like everything that's happening in the black community.
Yes.
Yes, sir.
Yes.
Yes, sir.
Yes.
And
Absolutely.
you see that a lot.
Absolutely.
Yes.
We have each of our clinics have full nurse practitioners on site. And one of the things that I know matters to me is when I go into the doctor, I don't want to see this one and then this one and then this one. I want to see
Valid
mine
point.
that knows me. And so we have nurse practitioners who are full time at both locations. So when you come in, you're seeing you're going to see the person that you saw the
person.
last time.
Yes.
They know your story.
Okay.
They know what's going on.
So I have my private doctor, and so every year I go and get my annual exam.
Yay.
So people who are involved in the TAN network, do they have the same option as I have?
Yes,
Absolutely.
absolutely, absolutely,
Yes, sir.
absolutely.
Yes, they do.
And our costs, as Crystal was saying earlier, the sliding fee is based on your family size and your income.
Yes.
We are funded by the federal government. We do receive our dollars from Health and Human Services, and they have their rules and regs that they want to meet, like with anything else.
Yeah.
And so when you come in, we're going to ask these questions, but it's a non-judgmental. I don't care who's in your home.
Yeah,
That's not my
yeah,
issue.
yeah.
But if you are an unemployed mom and you have 3 children, I am not about to charge you an arm and a leg for health care
Yes.
for you or your kids.
Wow.
And so to know that information allows us to provide even better services. So it's a partnership between us and the community for sure.
Okay, Crystal. So let's just say that someone comes in and they need a prescription. The practitioner
Yes.
writes out a prescription.
Yes, sir.
To a pharmacy.
Yes, sir.
Does that happen?
Yes, it does. And actually, that's a very good
that
point.
work?
I know, right? We have an on-site pharmacy.
Really?
And it is called Form Blue. They are actually in our, they're in our building. They're not our pharmacy per se, but we do have a relationship with them. So we have on-site pharmacy, and we also have patient navigators that help with medication assistance. So it is based on whoever qualifies, because they do have to go through a process, fill out an application. But once they're approved for that medication up for 1 year. So that gives them an opportunity to save money, possibly get medical insurance and things like that for a whole entire year. So yes.
And you can have your medications delivered to your home.
Oh yes, oh yes. I'm sorry, I forgot about that part.
Y'all are making this too easy.
High five.
Y'all are making this too
Oh
easy.
yes,
Yeah.
we try.
That
we
is,
try.
but that is also very important. If you, again, transportation, our elderly community who may have a hard time getting to and from.
Yes.
There's no reason why the medication, if your books and your toys and your treats can show up from Amazon on your front door,
Wow.
why not your medication?
Yes.
And so for, it's a wonderful incentive to utilize the pharmacy.
So what are some of the key health challenges that you see facing our community? Let's deal with this area, and then we'll deal with the outer area, with the the Newton and the other counties and all that.
Okay, so one of them is lack of understanding of the disease process. I would say that's probably one of the biggest challenges, because you may tell somebody they're a diabetic, but if they don't know the complications, if they don't continue to take their medications or eat their proper diet, then you may have some complications later on down the road that could be detrimental to that person. So we try to make sure that they understand through teaching and education the disease process. Then also you have your cultural differences. So belief, practices, and differences. Our providers and myself, as well as our CEO, we have to be knowledgeable of that, because people from different cultures practice things different, believe things different. There's things taught from generations to generations. So those are a lot of them. And then of course our non-compliance, and when I say that, I mean, I say that with love, because you can say, I need you to do A, B, and C. And they're like, oh, I'm going to do it. And they don't do it. So because of non-compliance, sometimes it can cause some issues. Like if you're if you have hypertension, which is high blood pressure, and you don't take your blood pressure medication, then unfortunately you can have a stroke because your blood pressure can get so high. That's hypertension is called the silent killer, because people don't know. They don't feel bad because their body is so used to that blood pressure being so high. You've adjusted. So when I give you blood pressure medicine, now you feel lousy because it's making you feel a little groggy, a little down. I didn't feel like that before. Well, let's give it about 2 weeks or so. And that comes with education. Let's give it about 2 weeks and see how you feel. And 9 times out of 10, they're feeling better. Yeah.
Now I must continue to say.
It's okay.
I must continue to say that don't worry about it. I must continue to say that this is for the insured and uninsured.
Absolutely.
Yes, sir.
Nothing changes because
No, we don't.
Go.
No, there's no discrimination. Whether you are insured, whether you are middle class, low class, it does not matter. Our job is to treat that person that walks through the door. We want you to feel just as important as any other person. We want to make sure that your care is the greatest quality of care that we can provide.
See, people are calling already.
I
love this. They see the number on the screen. Because look, I'm going to put the number on the screen. They're calling already.
Yes,
They're
yes.
calling already saying, hey, look, I want to be a part of this because this is...
Call us, please.
Yeah, call.
We will take care of you.
And we come from because I come from the social service community, and access is the biggest issue that we have. Yes. And if we can find a way to create the continuum of care from hello to great job and cover everything in between as best we can, then we begin to increase not only our health outcomes, but we actually have an impact on the health outcomes of our entire community. Yes. And that's the big piece. We can elevate this collectively.
And let's make sure that people understand these are not these are doctors who are professionals.
They went to school.
Yes,
They went to
sir.
school.
Yes, sir. Absolutely.
Hey, even though they say they're practitioners, they're not practicing on you.
No, they got it.
That's a good one.
They know what they're doing.
Absolutely. Yes, sir. Yes, sir.
Maya Casimir, who is our nurse practitioner in in Beaumont, and Larissa DeBlanc is our nurse practitioner in Orange. And they are also very instrumental in promoting. So we have a commercial.
Yes.
So if you hear the tan commercial on the radio, it's actually our nurse practitioner.
Wow.
So
Yes.
she's seriously telling you to come and see her.
Yeah.
Absolutely.
And so they're
Yes.
members of the community. They live and they're raising their families here.
Yes.
And so you can see them on the street. You can run into them.
But
they're real people.
I just want people that's watching today.
Yes.
You can get in touch with them.
I don't know if they some real doctors or not.
Oh, no.
Real.
They are the real deal.
Yes, yes.
Real
Board certified.
legit. Board certified.
Okay,
Absolutely.
let's talk about behavioral health.
Okay.
Who want to talk about that?
I'll take that one.
Okay. Okay.
So, and we started really looking at behavioral health from the aspect of mental health services as well as substance use disorders. And that's the real big chunk of a lot of what we see are folks coming in that are undiagnosed or have been undertreated for long-term mental health conditions. You tackle on things like Harvey and crisis, then you're dealing with just trying to vent, trying to figure out the steps, trying to manage. Behavioral health is often not included in the construct of primary care. This hurts, fix that. But you're not dealing with the impact of chronic disease. Imagine someone living with a disease for multiple years. There is a process to that, and we want to make sure that we are a part of sustaining you through these situations that you may go through or that your family may be going through. And so we have been implementing support services into the primary care structure so that people can say, I'm feeling this today. Well, it's not a medical issue, but our social worker or our counselor is here today. Would you like to spend a few minutes with them? We think of counseling as a 1-hour session with a psychiatrist and real intense, when really it's sitting on a bench going, what's up? How you feeling? What's going on? And really giving people a chance to become present within themselves.
Because I was going to ask to qualify, what do you mean by behavioral health?
So that could be anything from support groups. It could be anything from addressing a crisis that you may have. It could be sitting with a licensed professional counselor. It could be seeing a psychiatrist if you have bipolar or schizophrenia or something that requires medication. And so we like to go through the steps of determining what's going on and putting you in the right place to figure out the issue, and then building a system just like with primary care around how do we either fix or maintain and learn how to control. And these are all factors that just guide us through our everyday life.
So what other services do you provide besides primary care?
I think we've said a ton, but I'm going to try to add to them.
Hey,
No, you're fine. I know, right? So in addition to our primary care, like she said, behavior health, we also have, we provide support services such as transportation and, like we said, the medication assistance. We also have the on-site pharmacy, to where they can come and get their meds filled, and they can also get the punch-out packs. That's what I call them. I know there's a proper term for them. But it's easy for them to pop those pills out and have them delivered to home. And then also we have patient navigators that actually help you find those resources within your own community. So even though there may be something we may not be able to provide for you, our patient navigators get on board to help you find those services. Yes, sir.
So you give a recommendation on,
Absolutely.
Oh, no, we call.
Yeah, and
we'll call.
Yeah,
Yeah, we'll-
and God, yes,
We're
yes.
sitting together and we're going to call.
Yes.
Because, when you think about what a person needs, you may have insurance, but your insurance covers A, B, C, and D. Or, and your family may have something different. And so to navigate and even find out, if I call a provider for a specialty service and they say, well, we take Molina, Americare, but this person has Blue Cross Blue Shield. Okay, next call. And so that's a time-consuming process, but we prefer to do it along with our patient population in our community so that we can educate on how it's done. And it is timely, and it does take all day and all of those factors, but it's completely worth it. The other thing we have is in her area is a community engagement space.
Yes.
Where if you want to have your own support group, if you want to have an education program, if you want to bring in something to the community that's around healthcare or betterment, we have a space for you that you can come and go, can we rent your space? Low cost, but it's available for the community to access. Because again, being a community home is where you should be able to get, a good deal of the things that you need.
I agree.
A good deal of the things that you need.
And keep in mind, with a church in Beaumont, with your church, everybody may not live in Beaumont. You may have some people from surrounding and rural areas that actually come here. So they can always call us, and if we have a clinic in their rural area, a mobile clinic to where they may prefer, hey, I want to go here in my community versus making that drive, we're there.
Now this is different than the Affordable Care Act.
Correct.
Yes.
Okay.
Correct.
Yes.
So I want to make that plain.
Yes.
Now again, if you're insured or not insured,
That
you
is
still
correct.
can use this service.
Yes.
Absolutely.
It's not Obamacare.
No, we take any insurance.
Okay.
Regardless of, if it's a Texas approved insurance, and we're going to take it. And so we have no issues with the Medicaid and Medicare and covering that. But again, when you look at the uninsured rate of our population, that's much higher.
Yeah.
We have to be available for that population. Yes. We have to be able to create payment plans. We have to be able to, make sure that those costs are not going to impact their ability to get medication or whatever the other needs may be. Yes. And so that's the real beauty of community health, is that it is designed.
That's good.
They tell us this, and they tell you that almost as if it's a threat. You have to see people regardless of their ability to pay, and we go, great,
yes,
we love it.
exactly.
We're in.
That's us. Okay, what about for kids?
Okay, so that's a very good point. With pediatrics, when it comes to their immunizations, we're working on that, the vaccination process. We do refer them to their health department, but as far as sick visits and things like that, bring them on.
Wow.
Come on, absolutely. But
Sports
it's just
physicals in the summertime.
Yeah, that's a big one.
And it's coming up.
Yeah, come see us for your sports physicals. Bring those children. And it's not, what is it? What did we do? I think it was $10.
10 or
I'm
20.
almost
I can't
positive
remember,
it was
but-
somewhere around there.
But
Yeah.
affordable.
Yeah.
Absolutely,
Totally.
yes.
It's
Completely.
So if you don't have health care insurance and you need to find a place to bring your child because your child got sick.
Yes.
Here's Tan.
Yes.
Okay, Tan, where are we located at?
We are located at 1495 North 7th Street, and it's at the corner of 7th and I-10. And then our location in Orange is 3737 North 16th Street, and that is off of 16th and I-10. So we're both right off of the freeway.
Okay, now I'm going to put the numbers back up in the website so that you can go to their website and see their website address and get more information. And there's their number right there. It's on the screen right now, so that you can see how to get in contact with them in Beaumont. Now, I didn't have the Orange number.
That's okay. That's okay. It's on the website.
It's on the website.
It
It's on the
is.
website,
Yes.
so you can get that information. Hey, ladies.
We're also on Facebook, and so you can check us out at Tan Healthcare Beaumont and Orange on Facebook and follow along with some of the things that we're doing.
Now, ladies, I'm excited because you're partnering with us with a men's conference that we're going to have on May 25th.
Yes.
And so I'm excited about that one. So tell us all the services you're going to be providing for us on the 25th.
Well, we're still talking about everything. There'll be some surprises. So I don't want to say everything, but I know we have the breakout session, so there's going to be a lot of education, a lot of teaching, a lot of Q&A. So I'm going to give them the ability to ask some questions, and hopefully I will have all your answers. And for the answers that I don't have, I will get them for you.
and that's going to be at the Man Up Conference on May 25th, Saturday, May 25th. We're going to do it over at Mount Gilead Baptist Church from 10 o'clock to 2 o'clock. Lunch will be provided. Free blood pressure checks. What else have we said?
You have any screenings, like diabetes screenings, assessments? You're going to be talking about prostate cancer, all that.
Oh, that's going to be good. Men, I'm telling you, men, you want to be in this place.
Yes, you do.
Ladies, get your man to the place.
That's
right.
But you know
That's true, though.
Because that's important, because we as men are very reluctant to go to a doctor to get the health care.
That
And
is
then
true.
when we get to the place where it's too late
Yes.
and things have happened,
That is true.
Hey.
That is
it's
true.
costly.
Man, it's all about prevention. Prevention. That's what we want to do.
It really is. And having those conversations, because you're also giving that same message to younger folks. And so you're letting them know that healthcare does matter. I was at Lamar University a few days ago talking to young people and saying, no, you got to come in, you got to get checked. And so this is just that other. We're gonna keep wrapping our arms around it.
Yeah, now, see, when I was younger,
Yes, sir.
A couple years ago.
I didn't like to go to the doctor.
Right.
Yeah.
And I had insurance, but I didn't like to go to the doctor because, I'm thinking I'm healthy and all this. But then my wife convinced me. She said, I want you to be around for a long time.
Yes.
We have this health care insurance. Go to the doctor.
Go see.
And that was 30 plus years ago. And now I go to the doctor. Man, it's like.
Amen.
You know what? You go home.
He's my favorite person.
Yes.
That's it.
Yes.
You go, look, I'm telling you, go home, you put your arms around that woman and you tell her thank you.
Yes.
Because
Yes.
that makes a profound difference in your health care. You going early, you going to have all those screenings and tests, and here you are still able to preach God's word. But if you didn't, you don't know what could have happened. So
Exactly.
that's beautiful.
It is.
Yeah.
But again, this is so, look, if you
It's
have
easy.
insurance,
Yeah.
if you don't have insurance, I'm telling you, it's a sliding scale.
Yes, sir.
Sliding
Sliding
scale.
fee scale based on your income and your
Wow.
household size.
And
Wow.
we're not just HIV anymore. And I think that's one of the biggest pieces
Yes.
I really, really want the community to understand is we love our HIV community. Never turning our back, for
Yeah,
sure.
yeah,
but what we learned and what we were able to do, we want to expand and grow. And so anyone is welcome in the doors of TAN Healthcare for their healthcare needs or their mental health needs or their substance use disorder needs, whatever it is.
Wow.
Give us a call and give us a try.
Yeah,
Yes.
yeah.
Give us a try.
Hey, well, listen, this has been great. I'm telling you, this has been great. I want to thank Dena and thank Crystal for coming today to share with us about TAN. Again, let me put that number back on the screen with the website so that you could see how to get in contact with them. It's right there on the screen, right there at the bottom of the screen. Contact them. Listen,
Please.
no matter how many people you have in your family, this is an opportunity for you to get great health care service. So, again, I want to thank Dena for joining us and Crystal for joining us, and thank you for joining us here on What's Happening in Our Neighborhood. And we will see you next time on our broadcast. Be